guys, so I wanted to talk briefly about a uterine cavity evaluation and why it's often recommended by your infertility doctor and how often should it be performed and when should it be performed. A uterine cavity evaluation is looking at the inside of your uterus, and there's two ways that we can do it. One is called a saline ultrasound, and that's a water ultrasound, a transvaginal procedure where we place saline through the cervix, similar to an HSG if you've ever had an x-ray performed. And we introduce saline and basically examine the uterine cavity in the office while we're doing an ultrasound at the same time. That's a very fast procedure, takes a couple minutes. In general, it's painless and can cause mild cramping, but it's a quick exam that allows us to evaluate the inside of your uterus. The other option is something called a diagnostic hysteroscopy, and that's typically performed in the operating room. Sometimes we can do it in the office, but most clinics are performing them in the operating room. That's a nice option because it also allows us to introduce a camera and actually visualize the inside of the cavity. And if you're already under anesthesia and we have a high suspicion there's a lesion, we can operate at the same time and remove that lesion. So what lesions are we looking for? We're looking for uterine polyps, fibroids, scar tissue adhesions, or something called a septum, which is an anomaly that was part of your uterus when you were developing as a baby. How often should we do this? In general, most doctors do it every 1 to 2 years prior to an embryo transfer, not necessarily to a saline ultrasound, not necessarily prior to an insemination cycle. Generally, we're doing it prior to an embryo transfer and we have a higher suspicion that there's going to be something abnormally found. And what we're doing is trying to increase the chance of success that that embryo is going to implant. And if we see a lesion, we want to remove it prior to the transfer. So we're looking for large lesions, scar tissue, septums, polyps, fibroids, anything that can disrupt that uterine lining and lead to a lower chance of success for an embryo transfer.